Ontario's premier made it clear again today he doesn't think the time is right to reopen the border between Canada and the U.S. Doug Ford says it's just too risky. He and the premiers of Quebec and BC told the Prime Minister this week they don't want travel restrictions eased when the Canada-U.S. border deal expires May 21st. Negotiations are underway to extend that restriction. The border has been closed to all non-essential travel since March 21st, and Canada is trying to keep it that way until at least June 21st.
Conversations are ongoing, are constructive or productive. I won't make any announcements today, but I can say that things are going well and we're confident about being able to continue to keep Canadians safe.
With the approach of summer, many people are wondering what their holidays will look like. The tourism industry everywhere has been hit hard. Today, the European Commission set out some guidelines for how businesses in Europe might try to salvage the summer travel season. Crystal Gamansing reports.
A sun-drenched beach vacation sounds fabulous, but getaways seem far off in a world where garden centres are just opening.
This is our bread and butter time of year. This is when we get excited.
This is also bread and butter time for the tourism sector. It's unlikely Canadians will be taking in the sights from the London Eye or any other popular spot. Instead, the idea is to target the roughly 400 million people within Europe.
Hotels, restaurants, beaches, other tourist sites, they need to be run in a way that minimizes the risk of passing on the coronavirus.
European Union member states are encouraged to re-establish free movement, and guidance is being offered to the tourism sector. Resorts, for example, are instructed to start preparing locations where groups would gather so they can be physically distanced, to allow for digital bookings of pool areas and dining locations, and to get workers protective equipment. The recommendations come weeks after Greece, for example, said it wanted to open to Europeans. Everyone is waiting to see if the 2020 season can be salvaged.
This is $1 million question. Of course, this depends on all the countries and how they fare with this crisis, but we're aiming to open up sometime in July.
Many cities hit hardest by the virus rely on tourism and have been struggling financially even before the pandemic. And now most travel will be across land borders rather than flying into locations farther from home.
At the moment, when you're asking people to travel, you're asking people to counter fear. And fears and risks are much more manageable the closer to home they are.
The industry hopes it'll be a short transition from picking up crimson flowers to taking in a golden sky. Crystal Gamansing, Global News, London.
There's some confusion in the UK over government plans to ease lockdown measures there. After 7 weeks, people are being allowed more freedom to get outside, and they've been encouraged to go to work if they can't work from home, but also told to avoid public transportation. That's not easy in a city like London. The government also advises to wear face coverings on transit, but that's not mandatory. The plan outlined on Monday is a phased-in approach to ending the lockdown restrictions. Critics say it's confusing and potentially dangerous. In the U.S., there's a battle between the politicians and the scientists over how to tackle COVID-19. Our Washington Bureau Chief Jackson Prosko joins us. Late today, Jackson, President Trump spoke to reporters and he contradicted the country's top doctor. What did he say?
Hi, Donna. This battle between science and politics really has become a feature of the White House response. Some Trump administration officials are now reportedly casting doubts on the official death toll numbers provided by the CDC, believing they're too high. And you're right, a short time ago, the president disparaged his own top infectious disease expert, Dr. Anthony Fauci. Yesterday, Fauci testified that it may be unwise to send children back to the school in the fall without a vaccine because there's so much about this disease and its impact on young people that remains unknown. But the president is firing back. He himself, of course, is not a doctor. He believes this disease, though, only impacts older people. And a short time ago, he lambasted Fauci's testimony.
I was surprised by his answer, actually, because, it's just, to me, it's not an acceptable answer.
Jackson, without a vaccine, which we don't have, testing is one part of the way to contain outbreaks of COVID-19. At least 2 staff members at the White House have tested positive now. The vice president and the president are both being tested every day, but there's concern about the reliability of those tests.
That's right. Specifically, the reliability of a 15-minute rapid test that's really been promoted by the White House and used by the White House on the people closest to the president and vice president. A new study from NYU finds that it's missing between 30 and 50% of positive cases. That's a huge problem, especially considering the circumstances it's being used under. We should point out this study is preliminary, has not been peer-reviewed, and essentially calls into question the need for more research. Donna, like so much to do with this virus, there are a lot of unknowns and a lot of concerns that the fuller picture of the virus and its spread is still being missed.
All right, Jackson Prosco in Washington, thanks. The FBI says it is investigating hackers affiliated with China who are targeting researchers working on COVID-19 treatments. It says healthcare, pharmaceutical, and research organizations are considered prime targets and says they should take all necessary action to protect their systems from being compromised. The FBI recommends monitoring for unauthorized access and warns that media attention linking an organization with COVID-19 related research will lead to increased interest in cyber activity.
The new series that goes inside the COVID-19 pandemic, from the front lines to the everyday heroes helping us cope.